Flossing is an essential part of maintaining healthy teeth and gums, yet many people experience discomfort or even bleeding when they do it. While it may seem alarming, bleeding gums when flossing is not uncommon. However, it can be a sign of underlying dental issues that should not be ignored. This article will explore the reasons behind bleeding gums, how to address it, and steps to prevent it from happening in the future. Understanding bleeding gums when flossing. If you've ever noticed blood on your dental floss, you're not alone. Many people experience bleeding gums when flossing, and while it can be unsettling, it's usually a signal that something needs to change in your oral care routine. This could be an indication of early gum disease, improper flossing technique, or even poor oral hygiene habits. Bleeding gums are your body's way of telling you that your gum tissue may be inflamed or irritated. But don't be discouraged. Bleeding gums can often be remedied with the right approach. Common causes of bleeding gums when flossing. 1. Gingivitis, the root cause of bleeding gums. One of the primary causes of bleeding gums when flossing is gingivitis. Gingivitis is the early stage of gum disease, which is caused by plaque buildup on the teeth and gums. Plaque contains bacteria that irritate the gum tissue, leading to inflammation and eventually bleeding. If you notice blood when you floss or brush, it's a sign that gingivitis could be present. The good news is that gingivitis is reversible with proper oral hygiene and professional dental care. If left untreated, however, it can progress to periodontitis, a more severe form of gum disease. 2. Improper flossing technique. Another cause of bleeding gums when flossing could be an incorrect flossing technique. If you're too aggressive with your flossing, you could be irritating or damaging your gums. Alternatively, if you aren't flossing often enough, your gums might be more prone to bleeding when you finally do. When flossing, it's important to be gentle and avoid snapping the floss into your gums. Instead, carefully slide the floss between your teeth and hug the sides of each tooth, moving the floss in an up and down motion. This will clean between the teeth without injuring the gums. 3. Infrequent flossing. For some people, bleeding gums when flossing occur because they don't floss regularly. If flossing is not a consistent part of your routine, your gums may be sensitive when you do floss. Regular flossing helps toughen the gum tissue over time, making it less likely to bleed. 4. Medications and health conditions. Certain medications, such as blood thinners, can make your gums more susceptible to bleeding. If you're on medication that affects your blood clotting, this could explain why your gums bleed when you floss. Health conditions like diabetes, hormonal changes during pregnancy, and even stress can also increase your risk of gum inflammation and bleeding. Keep your gums healthy with Atlantic Dental Group. Bleeding gums when flossing is a common issue, but it's not something to ignore. Regular oral hygiene, proper flossing techniques, and professional dental care are key to preventing and treating gum issues. If you're experiencing bleeding gums or have concerns about your oral health, don't wait. Schedule an appointment with Atlantic Dental Group today. Our experienced team is here to help you maintain healthy gums and teeth for a lifetime. Contact us now to book your consultation.